In order to apply a wound vac, you will need to have a moisture-proof barrier or a chuck, your gloves, a metric measure to measure the wound, some skin prep, scissors and alcohol. Make sure that you clean your scissors very carefully in between each dressing change. And you will need to get your sponge also. This is a granuform sponge, and it comes in black, white, or silver. Check the doctor's orders to make certain you get the right type. And you also need plenty of drapes. These are called drapes. It's similar to oxide or Tegaderm, but these are called drapes. And make sure you get plenty of them, as you will need to create a very good seal around the wound. You will also need more tubing and a new canister if you need to replace the canister for the negative pressure system. Make sure that you have placed a moisture-proof barrier here, or a chucks underneath the wound where you're going to be working, so that in case there's any drainage. What you want to do is first measure your wound so you can properly document, and make sure and note if there's drainage, what color, things like that. Then you want to take your normal saline, or check the doctor's orders what he would like the wound irrigated with, and make sure you irrigate the wound, first the inside, and then you can take gauze and just dry it out, making sure that there's no residue left from any previous dressings, and clearing the outside also. Next, you can take your skin prep, and this will help the drape stick to the skin site. Make sure that you kind of get all around the wound. Next, you want to take your sponge and cut as much as you need off, and try and make it match the size of the wound exactly. Try not to get any small pieces from the sponge into the wound bed, as that'll grow in to the wound as the wound heals. You want to make sure it doesn't overlap from the wound. You might need to cut and trim, trying to get it as exact as possible. Place it on. Once you have made the sponge fit as exact as possible, hold it in place, and then get your drape. Okay, once you have the sponge to fit the wound as closely as possible, then get your drape and place it over the wound. You'll remove the first layer, and make sure your patient is pre-medicated, because this will be very uncomfortable. Make sure they have enough pain medication. At this point, the main focus would be to get the seal on the top of the wound, and you can worry about the edges afterwards.
Pain medication, please.
Different. There we go. Okay. Then use as much drape as you need to. probably, that's not necessary to have that as high up. Okay, once you've got a good seal on it, you're going to want to cut a hole for the wound vac to be placed on. Depending on the size of the wound, you might need more than one tube, more than one vacuum tube. Then take the tube and place it. You probably want this to come out of his down the bottom of his shirt or gown, so have it pointing down. Okay, we'll place that right over the hole so it lines up, so it creates a good suction. Okay, then you'll want to take more drape and the suction tube. Then you're going to want to create a good seal over the suction tube. Then you will hook the end of the tube into the negative wound pressure system. Once the tubing has been connected, turn the power on to the negative pressure system. If you hear a loud sound, then there's a leak, and you'll want to place as much drape as you need to seal off any leak. You can listen with your ear to see where you hear any air leakage. Once it's been sealed off properly, you won't hear the sound of the motor anymore. If any leaks have been eliminated, make sure that you check the wound vac several times throughout the day, and to make sure that you haven't developed any new leaks, and seal them off if any have. And you'll want to record the drainage that is in the collection canister in your I&Os.